So, hello guys, it's really a pleasure to be here. Hello Matteo, hello Igor. Thank you very much
Hello,
for
Tulio. Hello, Matteo.
thank you very much for organizing time to be here. Nice to be here. That's our new video section from LACES. And I just want to introduce our guest from today is Dr. Igor Mokryk. That's the chairman from Kiev Heart Institute in Ukraine. And we have a specific topic for him today. It's about finite players' place to win and infinite players' place to stay in the game. Finding ways to circumvent possible obstacles in your region and to keep producing outstanding results. We are really glad to have you here, Igor. I think that everyone is following the current situation in Ukraine, and we are really sorry that you are facing this unpleasant moment. And I really would like to ask you if you can give us a brief information about your biography. Where did you do your training? How was the pathway to be where you are?
Sure. Unfortunately, it turns to be long, and I'm not a resident anymore, not junior surgeon. Well, I graduated from Ternopil State Medical University, which is in Western Ukraine, and I went to the residency to Amosov Institute of Cardiovascular Surgery, which is central cardiovascular clinic in Ukraine and one of the biggest alma maters of cardiac surgery in all over former Soviet Union. And after 1 year there, I was granted to go to study at International Heart School in Bergamo in Italy under leadership of Professor Lucio Paranzan. It was an amazing time I spent with him. After that, I was granted another year in Italy as ESCTS fellow, also in Bergamo. And then I returned back to Kiev and worked as pediatric cardiac surgeon again in Amosov until 2007, when I was invited to become a chief of pediatric heart surgery department in Donetsk. Actually, it was a position that needed to start a whole cardiac surgical program in Donbas region of Ukraine, which is huge. It's almost 6 million of people, and they needed pediatric heart surgery program, and we did really real well. And in 7 years, we managed to develop a really active program and almost entered in a newly constructed 9-story pediatric heart surgery center with 24 ICU beds. But the war started. Russia invaded Ukraine in 2014, and all of my team and me, including with my family, we had to escape Donetsk, and I was invited to go to Poland, and I spent almost a year and a half in Silesian Center for Cardiovascular Disease in Zabrze, together with Professor Marian Zembala, and that was really another amazing time that I really appreciated. I trained adult heart surgery there real deep, and I was invited after that to come back to Ukraine and become a chief of adult heart surgery department in biggest cardiac surgical clinic of Ukraine, which is Heart Institute. And now I work there, and well, we keep on moving on, facing new challenges and trying our best in order to help our patients.
Okay, sounds really good. Thank you very much for giving this information to us. And I think that's quite obvious how the war changed everyone's life in your country. And I would like to ask you if you can give some insights to us how this war affected your daily life as a surgeon. Can you please comment a little bit? How is your current routine?
Well, of course, war changes everything, but your basis. what you're standing on. And for us heart surgeons in Ukraine, what we do is one of the basics of our life. So we were expecting that war has to start. Everyone was speaking of that. Of course, we didn't want to believe it will start, but the probability was there. And in our institute, together with our director and all staff, we met sometime before the war actually erupted, and we agreed that if anything like that happens, we will stay at work. We are not going anywhere. We will stay at work. And that is what happened. And the first day, now we came to work and we stayed there. After one week, we took some days off in order to move our families out of Kiev because of the risk that Russians will enter, and actually there will be clashes within the city. All of us have kids, so I moved my family to Poland and returned right away. And after that, for 2 months, we actually lived in the hospital together with our patients, together with victims of war who were coming to our hospital to get help. And the situation started changing when Russians were just forced out of Kiev region and all over northern and central Ukraine. The roads opened and we faced an inflow, very big inflow of patients from Western Ukraine as well as from Eastern Ukraine. And since that time, we keep on being active in operating room to help our patients, though we still continue to help soldiers and civilians with combat trauma of cardiovascular and pulmonary system.
Interesting. And did it go now back to the normal life, to the normal reality, or are you still working under, let's say, abnormal conditions?
Well, the war, it's one of the biggest risks to get adapted to war. The war is something that we have to stop it. The only way for Ukraine to stop it is to win it. And that is why each one of us is doing our best in order to either to help our military or to help our people. So yes, we go to work, but it's still the work within military conditions. So we have air raids, we have rocket and drone attacks on our infrastructures. We face the blackout even in time when you are performing heart surgery. Last winter, actually, this happened when I was doing a bivalvular prosthesis, and I was in the middle of the cross clamp when just everything stopped and we had to move on for a couple of minutes on accumulators. But backup generators restarted and we managed to complete all of our surgeries, and and all of our patients safely were moved to ICU. So we doing what we used to be doing during the civil and normal life, but within the military conditions, within conditions of war. And this is different approach.
Okay. And I wanted to ask you something else. I mean, it's not comparable because, of course, we are not working in countries which are in war, but we all know how external situations can influence our performance and how we feel and how we work. So I don't know, if I have a problem at home or whatever sort of personal problems can really impact your performance. So I wanted to ask you, how did you manage to deal with that, knowing that out of the hospital there are a lot of problems and a war going on and people dying, and you are there operating, you have to keep calm and keep doing your thing. So how did you manage to do that? Because that's actually, I admire you for doing that.
Well, thank you. But honestly speaking, there are no any special methods or tricks, I would say. And as cardiac surgeons, we all know that when you are concentrated on surgery, there is nothing else around you. So we really had made our choice is to help our patients no matter what. And since then, everything becomes not easy, but well, clear and understand that what you have to do in order to make this patient safe. For instance, when I was operated on that lady, and that I reminded, and everything turned off in the moment. There was no even a second of delay of what we were doing. We even started doing everything faster and more automatically, I would say, in order to bring this patient out of this situation as fast as possible with the result, which is only possible, which is successful surgery. So, and I think this is how all of us are working now. We really just are on some a bit maybe higher level of motivation that everything we do has to be done even better, because it requires more resources, mental, emotional. But personally speaking, for me, the situation is when I can work stable, is when I know that my family is safe. That is something that's really necessary. So now this is the situation, and for me it was very, very important.
So Igor, thank you very much for these words. As Matteo said, we really admire your attitude, like when you're facing this kind of situation. It's just incredible. I have for you the last question. Is there any way that the other centers, just not in Europe, but in the entire world, how can we help you? Is there any way in academic point of view or any kind of assistance that we can give to you in this moment?
Thank you for that question. That question is really important, and I'll explain you why. It's not even more about details, but the question about the fact, because this is war which is going on, is the war of Ukraine for Ukraine to make our own choices. Our nation had made a choice to be a part of international community, of European Union, of actually global society, and being part of it is extremely important for a whole nation and for each one of us. So being involved in interviews like this, in congresses that we go, in just relationships with colleagues, with participating in international scientific life, in or medical life in different ways, like exchanging ideas or helping armed soldiers or civilians who are victims of war in whatever different way, it really makes you a part of global society, of civilization, which we want to be part of, and we are proving this right in the battlefield. So the practical steps would be is like just asking Ukrainian centers whatever you need in order to help your patients. Is there anything lacking? And I would notice here that we really, really help very many patients thanks to the support that we received from our colleagues, including cardiac surgeons from neighboring countries and from all over the world, including valves and materials and devices, and we keep on receiving them. So I would ask to continue to help, because nothing is ended yet. And this is like material part, but also scientifically wise, if there are any projects that you think that Ukrainian doctors can participate, and there is a real big scientific societies in Ukraine who would really be interested in participating and contributing a lot to scientific developments. I would really also recommend to involve Ukrainian colleagues. That would really help. And if there are any opportunities for training of Ukrainian doctors, especially young ones, I would also be thankful if they are opened, and these possibilities will be used for the good of Ukrainian doctors and, of course, Ukrainian patients and whole our nations. And we would be very, very thankful for that.
Okay, I hope that this message will reach people that are helping and new people that wants to help you, for sure.
Thank you very much.
Okay, Igor, do you have any final words?
Once again, I want to thank you for being interested, for being open, for being helpful, and for inviting me. I do hope that that will be example to invite many more Ukrainian doctors just to participate in various activities globally. And this is really, really something that we are fighting for, and we would be thankful for that.
Okay, perfect. So thank you, guys.